Mask Up Utah was launched June 23rd by the Utah Hospital Association and its partners. The collaborative effort among 4 major hospital systems is an effort to try and stop the heightened spread of COVID-19.
We are seeing a disturbing and quite frankly, an alarming trend in an increase in COVID cases. Really, since May 27th, we've seen increases in cases throughout the state. This isn't isolated to a single outbreak. We are seeing increases throughout the entire state of Utah. In addition, our testing has plateaued. And so this is not a phenomenon from an increase in amount of testing. This is true increase in community-based transmission.
Now we're 9th in the nation. We were 7th yesterday. The good news is from these data is that for whatever variety of reasons in Utah, the people who die from the COVID disease is actually a pretty low rate. In fact, we are the lowest state or region. We're number 51 in the country for a death rate, right around 1% or less.
An estimated 60% of the COVID cases in Utah are said to be spread through households, and only 40% through other social contacts. During an online press conference, medical doctors and hospital CEOs spoke about the need for the sick to stay home, continue social distancing, practice personal hygiene, and wear a mask no matter what type.
We need to stop giving one another coronavirus infections. So today, I join my colleagues in asking you to hit the brakes on COVID. I'm asking you to do this by wearing a face mask whenever you're outside of the home.
Mask Up Utah is a simple yet extraordinarily important idea. It is that seatbelt that we all have an opportunity to put on every day. We do it for ourselves, our friends, our family. For us, it's for our patients and healthcare workers. And that's the type of simple step that can make a real difference.
The number of positive tests in Utah has increased between 400 to 600 cases per day. The state has reported 163 COVID deaths and 1,226 hospitalizations. Doctors say if these continue to rise, it could tax our hospital bed capacity.
Within Intermountain Healthcare, compared to a month ago, we have doubled our COVID-19 cases in our hospitals. We currently have the capacity right now to care for these patients and offer them advanced therapeutics. But if we continue this trend and we do not abate the crisis that is going on now, we will reach capacity in the coming weeks, and we will no longer be able to care appropriately for patients with COVID-19 and also those that seek care for other reasons.
The newest campaign will be placed on billboards, Twitter, Facebook, and other media and talk shows to mask up for others.
Masking is not about you. Masking is about everybody around you. This is to prevent the spread of potential COVID from you to someone else. Mask up, do the right thing, and help us flatten the curve again and reduce the issue of COVID, not only here in Utah, but around the nation.
Children will also be asked to wear masks throughout the summer when they aren't outside or can't social distance, and possibly into the school year.
As far as children wearing a mask, their risk is similar to adults in terms of contracting the disease. Their illness severity seems to be lower, but a child can spread it. In fact, a child is probably a more efficient spreader of coronavirus than an adult would be if they had the illness.
It's said that all masks slow down respiratory secretions during coughs or sneezes, and that's why they are effective. However, there are those who are concerned about the lack of oxygen that may not be allowed in during respiration.
There is somewhat of a trend sometimes for people to wear a mask, maybe part way. Maybe they wear it across their mouth, but not across their nose. And while this may be better than no mask at all, it still is way less than optimal.
The Mask Up Utah campaign will also address Hispanic and other populations who don't speak English. While the cost of the campaign wasn't addressed or who will pay for it, hospital officials are hoping this message will keep the state from going back into the red and the potential of shutting down businesses not deemed essential once again.
Because the states where people are wearing masks have less spread of COVID disease. That's a fact. We're starting to get evidence to support that fact. And my plea, along with everyone else on this panel, is that we all should do our part to protect ourselves and our family and others around us.
Utah's governor supports the Mask Up Utah campaign, however, doesn't plan to make it mandatory. In St. George, Melissa Anderson, Community Education News.